This video is for my postpartum assessment checkoff. The first thing that I'm going to do before I walk into the room is check to see if this woman had a C-section or a vaginal birth and if there were any complications with the birth. As I walk into the room, I'm going to introduce myself and make sure that I'm maintaining dignity and communicating at a level that is appropriate for her education level. I'm going to be washing my hands and performing vital signs and then asking the mother about the birth history from her point of view. The first part of the mother that I'm going to be assessing is her breasts. My first question is going to be, are you bottle feeding or are you breastfeeding? Because the education differs between the two feeding types. So if the woman is bottle feeding, I'm going to make sure that she knows not to stimulate her breasts too much. So the partner should not be touching her breasts. She should try not to touch her breasts too much. The warm water in the shower should not hit her breasts. She should be wearing a tight-fitting bra, and she should be using cool packs if she has any pain. For a breastfeeding mother, the education that I would want to provide is to make sure that the baby is latching correctly. And then for both mothers, as I am looking at their breasts, of course, if it's a bottle feeding mother, I would not be touching. I am looking for, are these breasts red? Does this mother have nipple cracking? Is this mother engorged? Are there any hard spots? Is this mother in pain? The next part of the mother that I'm going to be assessing is the uterus. So I'm going to start by putting my hand at the bottom of the abdomen and then my other hand at the top about the level of the umbilicus and slowly push down to find the top of the uterus, which is the fundus. I'm going to be feeling, is this fundus hard or is it boggy? And if this fundus is boggy, I'm going to need to get help. This is a sign of hemorrhage. The fundus should be a finger length down each postpartum day. So before I walk into the room, I'm going to need to know how many days this woman is postpartum. The next part of the mother I'm going to be assessing is her bladder. How many times has she urinated? Is this normal for herself? We need to make sure that the woman is urinating because a full bladder can block the fundus from lowering and contracting as needed. The next thing that I'm going to assess is the woman's bowel habits. Has she gone since delivery? Some women, especially women with episiotomies, can delay going to the restroom because of pain. They're afraid that it may hurt too much. We need to make sure that the woman is comfortable with going to the bathroom before she goes home. The next part of the woman that we're going to be assessing is her lochia. The lochia should be bright red the first couple postpartum days, and then it should change to light pink. And then later on, it will go to a clear yellowy color. So we need to look and see what color is the drainage, how much is draining. It should not be more than a pad an hour of the rubia blood, because that can be a sign of hemorrhage. The way that we check to see how much the woman is draining is she going through more than a pad an hour? How many pads is she using an hour, or how long does she keep a pad? We can also weigh pads. So the next part that we're going to want to assess is her episiotomy or her perineum if she does not have episiotomy. We're looking for the signs of Rita. We're looking for redness, erythema, ecchymosis, her drainage, and the approximation of her episiotomy. The next thing we're going to be assessing is homicide, though we do not palpate and look for the homicide because we do not want to dislodge a clot. We do look for leg pain because that can be a sign of a DVT. Next, we're going to be assessing her emotional status. We need to make sure that this woman is okay with taking care of her baby, that she has a proper support system. We need to make sure that there are no risks for postpartum blues or depression. And we need to see if this woman has taken Rogam or if the woman needs Rogam. Before I leave the room, I'll make sure that the woman does not have any questions, and I'll check and see if she needs anything.